New for you this morning on Daybreak, patients who have survived COVID-19 may have to face another battle. That's post-intensive care syndrome, which is pretty similar to post-traumatic stress disorder.
And their family members could also experience the same feelings. KIMT News 3's Madeline Watkins joins us live now to tell us about how we can best transition into post-pandemic living. Madeline, good morning.
Good morning, Brooke and Tyler. A therapist here at Zumbro Valley Health Center tells me she's seeing an increase of patients coming in with post-intensive care syndrome. That's because of how many patients were in the ICU with COVID-19 over this past year. So I first want to explain PTSD and break it down for you. That's post-traumatic stress disorder, and it's pretty similar to post-intensive care syndrome, or PICS. Heather Gertz tells me with PTSD, some signs that you should pay attention to are not being able to leave home, you're canceling plans, or even physical symptoms like sweating, a racing heart, or you're feeling nauseous, all of which can happen when transitioning to post-pandemic living. PICS is when long-term ICU patients develop symptoms of forgetfulness, they have difficulty talking, or poor concentration. Gertz says it's important to realize that PICS can also happen to loved ones of ICU patients.
We know that secondary trauma, that hearing that trauma can affect you, right? And that's almost what family members experienced. They didn't go through it. They didn't experience it firsthand, but they did experience it.
If you or a loved one are experiencing PICS, medical experts encourage you to talk about current events, play memory games, or even keep an ICU diary to kind of help cope with that anxiety that you might be having. Live in Rochester, Madeline Watkins, KIMT News 3.
Thank you, Madeline. 30 to 80% of ICU patients experience PICS after leaving the hospital, according to the Society of Critical Care Medicine.